Good afternoon, everybody. It is a pleasure to welcome you all to the University of California, Irvine. I am Jon Gould. I'm the Dean of the School of Social Ecology. And you may be asking, what is the School of Social Ecology doing interacting with Everfree on an issue like human trafficking? And for those of you who are friends of the school, the answer comes to you immediately, because you know that in our School of Social Ecology, we don't just study social problems, we also try to work in partnership to solve them. And in doing that, we are always looking for partners in the community, whether it's here in Orange County, across the state, the nation, or the world, the kinds of organizations that are committed to bringing positive change to the community and to using research to be able to move the needle forward. And in that respect, we are delighted to be able to work with Everfree. Everfree, as you may know, is headed by Kelsey Morgan, who is an alum of our school, so much so that a couple of weeks ago, I'm going to brag on her here for a moment, Kelsey won the Lauds and Laurels Award from our school as the top alumnus, or alumna, in the school this past year. And I had an opportunity to give her the award at a very, very large gathering out at a hotel, multiple hundreds of people. We all dressed up. You don't know this part of the story, Kelsey. So we dressed up, she came up, we had our picture taken, and afterwards, I sent the photo to my daughter. And my daughter texted me back, "Dad, what are you doing with a movie star? Who is that you're with?" And I texted her back, "You have it half right. She's not in movies, but she's a star." Kelsey Morgan is exactly the kind of alumna that we hold out as being exactly what we are trying to do in the School of Social Ecology. This is someone who from the very beginning was committed to improving the lives of others here and abroad. She has taken that passion, that energy, and not only started a nonprofit, but has seen it grow and be incredibly successful. And then she came back to get more education. She is now Dr. Kelsey Morgan as of this past summer. And she is Dr. Kelsey Morgan from the School of Social Ecology. So you probably don't need to hear any more from me. Instead, let me turn it over to Dr. Morgan, one of our most distinguished alums, who will lead us in the program this afternoon. Kelsey.
I've never been mistaken for a movie star, so I think I'm still red, blushing from that really warm welcome. Thank you. We're so happy to be here today with all of you. We have such a powerful room of change makers gathered here today, from folks who are working with survivors of exploitation and the most vulnerable in our community day in and day out, to the folks who raise critical funds and fuel those efforts, to those who are pursuing justice and implementing policies at local and state levels. This is a room of people who can really get things done, and we have an agenda that's going to set us up to do exactly that today. Our goals are to share insights from the Freedom Life Map tool. If you don't know what the Freedom Life Map tool is, you are definitely going to go deep into that tool today to understand what it is and what these insights are for Orange County and beyond. We're going to share insights on why Freedom Life Map is valuable for survivors and organizations, and we're going to talk about the catalytic effect of investing in data and tools and technologies like Freedom Life Map. We have some incredible speakers who are going to join us up here today, as well as speakers who are going to be leading sessions in our breakout rooms, which will take place after lunch. We have Dr. Angela Robinson, who is a researcher at the UCI Blum Center, and I'm very honored to call her my research partner and co-creator of the Freedom Life Map tool. And we have Professor Richard Matthew, who I think his resume is something like 50 pages, so we won't get into that. He is incredibly prolific in his research and the way that that research has impacted some of the largest social issues that we're facing in society today. We're here to talk about exploitation, and exploitation broadly to us encompasses modern-day slavery, gender-based violence, and labor exploitation. And we know that exploitation intersects with those who are most vulnerable in our society. And so we have folks here who work with those serving foster youth, homeless youth, and we're so happy that all of you are here today to dig into this important subject. And to kick us off, Richard Matthews is going to talk about the state of exploitation here in Orange County and beyond. Thank you, Richard.
Thank you, Kelsey. Thank you, and it's really wonderful to see everybody here. This is such a beautiful location, such a beautiful place, it's a beautiful day. This is not a beautiful topic, but the setting is appropriate for it, National Academy of Science building. And what I want to do is, I'm sure lots of you have a sense of human trafficking. I want to just create a little bit of context for what we are doing. It's illegal everywhere, and it has been illegal for over 40 years everywhere on the planet, much longer in most of the planet. And yet, it's never been easier to buy and sell people than it is today. The number of people who are considered slaves today has increased by 25% in the last decade. There's at least 50 million people in that condition, more than 1 million in the United States. And if we just take that proportionally, that would mean that it'd be about 10,000 in Orange County. That's a lot of people. Meanwhile, as the numbers are going up, prosecutions are going down. And when we think of other things that are horrible that take place, out of 8,000 homicide victims, we'd expect about 4,000 prosecutions. Out of 8,000 rape victims, we'd expect an abysmal 80 prosecutions. And yet that's still 80 times higher than what we're seeing in human trafficking. This is one of the lowest numbers for a crime of this. This is the lowest number for a crime of this magnitude on the planet everywhere. And that's a real problem. If we extrapolate, a couple of years ago, a study was done in the UK estimating the benefits to the groups who exploit people and the cost to society. And the benefits, in aggregate it's a large number, $150 billion a year. On a per person basis, it's around, for the global north, for the wealthier countries, because there's a difference, about maybe $90,000 to $100,000 of profit extracted by destroying somebody's life. The cost to society is over $300,000 for each of those individuals. The cost to the United States of that 1.1 million people is almost $400 billion. That's how much it is going to cost in law enforcement, medical services, victim support, and all these things. $400 billion. That's an interesting number because, it's estimated that for half that amount, we could solve the problem. And if we solve the problem, society would also, instead of paying the cost of this type of crime, we'd be benefited from having these people integrated into the workforce. So just on the basis of the numbers, it really is a crime that makes no sense. It's immoral, it's illegal, it's costly, it just, I think, causes enormous amount of human suffering. And it intersects with a whole lot of other things that are going on that are bad, which is probably why it's increasing. Right now we're living in a world where violent conflict is going up, natural disasters are going up, forcible displacement of people are going up, and so on and so forth. You can read the list. The result of all of this is we have more and more people on the planet, in our country, in our county, in our city, who are vulnerable, acutely vulnerable to being exploited in this particular way. So there's no shortage of people facing a set of conditions that make them very, very vulnerable to being exploited. There's no shortage of people whose future is going to be shaped by extreme long-term suffering. And as I just said, it's profitable for a few groups, criminal organizations, terrorist organizations, and some other people who are willing to turn their eyes the other way. But it's not profitable for the rest of us. Saving a few cents on the cost of seafood or the cost of coffee or the cost of chocolate does not compensate anybody for the level of suffering that we're seeing. So we have a shared interest in supporting the survivors of human trafficking, the victims of human trafficking, and finding ways to reduce the drivers of it, to reduce those things that lead people into this condition of extreme vulnerability. And the public, like it is on many of these other issues that I just mentioned, is aware of the problem and sympathetic and wants to do something about it, has a fairly good understanding of the problem, but it's not at the top of very many people's lists of things they're going to devote time to. So, we would love a society in which people, as part of their everyday life, embrace those people who are vulnerable and in need and let them know they're not alone. But we don't do that very often in this world. We know they're suffering, and we just can't get over. We've got other things to deal with, and we can't get past them to actually do something about it. And that's sort of a sad state of affairs for all of us. But if the moral argument isn't compelling, the economic one should really motivate all of us. Because the public is aware of the problem and it knows it's a big problem, and it would like the problem to be solved by somebody, which is where we come in. I think that this is we're looking at the trends. More and more exploitation, very, very high rates of re-trafficking. Kelsey did a dissertation on this topic and said, what do we know about what's driving the problem, what works and what doesn't work? And what she discovered was there's a lot of gaps, there's a lot of fragmentary data, there's a lot of misunderstanding, and there's a lot of things that we don't understand at all. And as a result, in many parts of the world, we're seeing 80 or 90% of the victims being re-trafficked, even after they've been supported by people who are trying to do good in the world. So we need to find another way of addressing this problem. If we allow it to continue on, if it continues to grow at its current rate of 25–30% a decade, it is going to become a problem that defies solution. It is going to be too extensive. But right now, it seems like the sort of problem. So we've spent the last few years, Kelsey and Angela will talk about this, Kelsey will talk about this, working on a solution that is sort of a little bit unlike what exists because it's driven by data. And I think all of us know that there has been a dramatic revolution in the world in the past 20 or 30 years in data science. So things that were unknowable, literally unknowable 20 or 30 years ago. We knew this much about the human brain. We knew this much about climate change. We knew this much about what goes on at the bottom of the ocean. We now know this much because of enormous advances in collecting data, sorting data, even huge amounts of data, processing that data, and discovering trends and patterns and anomalies in that data that nobody ever could have discovered before. So data science is incredibly valuable. And what it requires is good quality data. It requires that you generate the data that is useful and reliable and accessible and that can be used by everybody so that you can do two things. You can actually help at the most finest resolution, the individual. And you'll see in a minute, the Freedom Life Map is very focused on providing explicit, useful, trackable support to real individuals. But that data also aggregates up into broad data sets that also allow us to see patterns and trends and inform advocacy, inform education, inform policy making. And I think Kelsey's going to talk about this in a minute, but I'll just say the business sector, the for-profit sector, has long figured out, it's looked over this dramatic change in data science and it's said, there's a value proposition, there's another one, there's another one, there's another one, there's another one, and it is harnessing data to making money, and it's doing it very effectively in pretty much every domain. But the nonprofit and the public sectors have been much slower, and there's all sorts of reasons for that. If you're a coder, if you're a GIS expert, and you can make $500,000 a year in the private sector and $100,000 in the nonprofit sector, so they've got a corner on the expertise. And there's legitimate concerns about when you collect this intrusive data. What are some of the ethical challenges that you might face with a disadvantaged community? And there's also, and I think that this is something that we would love advice on, if you're working in the for-profit sector, if you're working in the private sector and you find ways to make more money, there's an immediate benefit to you. You become richer. your employees become richer. So there's a huge incentive to innovate, experiment, find more efficient ways to do things. In the not-for-profit sector, your funding might not be continued just because you're using a lot of data. In fact, there's lots of people who are scrambling for funding year after year, whether they're having a lot of impact or whether they're not. So that close relationship, use the data for money making that we see in the private sector, isn't as tight. Use data for impact in the public and not-for-profit sectors. And so we've got a set of challenges, and what we've done, we've spent the last few years trying to figure out a solution to those challenges. So, and that means that we have to develop data. We have to develop a reliable way of collecting data and make it usable, make it reliable, allow it to be scaled up so we can help individuals and also inform with big picture policy. And at this point, let me turn it back to Kelsey, who's going to talk a little bit about what we're doing to try and harness the power of data today. Thank you.
Please dig into your meals. We have food coming out as soon as you finish your salads and bread, so we're going to be here for a while. We have a captive audience to listen to us talk about data, so we're going to use that time. We love when anyone wants to listen to us talk about data. So as Richard has set up, there's a lot of challenges that we have in our world today. And one thing that we've seen at the Blum Center is that there's a lot of data on how big the problems are, the impacts on society. We don't have a lot of data on how to actually solve these problems. And I think that leaves us feeling overwhelmed. It definitely leaves donors feeling overwhelmed. It leaves society feeling overwhelmed. We need to be moving the social sector towards data that can actually solve problems, not just talk about the scope and the size of that. And with our innovations in technology, we have more opportunities to do this than ever before. Richard started talking about the data divide, and I want to dive into that a little bit. In the last 20 years, corporate profits have risen more than 252%, from the billions to the trillions. Most researchers credit this to their ability to use data to grow and scale their businesses. In contrast, the social sector has made very little growth, in fact less than 10%, when we look at progress towards our Sustainable Development Goals over the same 20-year period. So what is behind this huge divide? The for-profit sector is growing and scaling, the social sector is pretty much stagnant. In the for-profit sector, data-driven strategies are deeply integrated into business operations, leveraging advanced analytics for customer insights, operational efficiencies, and scalability. Companies invest heavily in what we call refining data to stay competitive, with entire infrastructures dedicated to transforming raw data into actionable intelligence. The social sector is in stark contrast to this and really lacks usable data. So some folks would say, okay, social sector maybe doesn't have the resources, it doesn't have the ability, but there's another key gap that's missing, and it's having raw data to be transformed into actionable data. Nonprofit and social sector agencies often lack the resources to convert this raw data into useful insights. They're bogged down in day-to-day programming, right? They're trying to meet the needs right in front of them. Setting up complex data systems is not a top priority and not always a skill set for those in the social sector. But without refining this data, it's challenging to evaluate impact, to adapt strategies, and to scale solutions that actually work. So the result is this data divide for the social sector, where valuable information remains untapped, limiting program effectiveness and evidence-based decision-making. But there is a solution to unlock the power of data for impact. And I want to walk you through what a data refinery looks like and how it works in the social sector. So when we look at this pyramid, this shows the different levels of a data refinery or a data processing system. This first level of data needed is that raw, programmatic, individual level data. This is the data our service providers in the room are collecting when they bring someone into their programs and when they track their progress along those programs. Platform level data is when we take those individual organizational data and we put them together using systems that track common metrics of success and demographics. The next level is aggregation. We take all of this data and we analyze it at scale to identify trends and anomalies. We then transform that data at the top level into actionable insights. These can guide decision making and help us actually scale what's working. The for-profit sector has done this really well. It's time for the social sector to do this, and this is exactly how we've designed the Freedom Life Map tool to operate as a data refinery. We're going to walk you through how this data refinery works within the Freedom Life Map tool at every level. And our mission with Freedom Life Map is to end exploitation with better care, better data, and stronger collaboration. So let's talk about better care and this first level of data collection. This is where we collect data working with programs who are serving survivors of exploitation and those at risk. Through this data collection and Freedom Life Map, those individuals access individualized, multidimensional support that actually meets their needs. Through this process of data collection, we've designed a program that is strength-based. It restores a sense of control and self-efficacy just through the way that the data is collected. It also improves outcomes. We learned through other research that for every need met for a survivor of exploitation, their odds of stabilization increased by 1.6 times. So if you have a survivor come into your program, they need housing, healthcare, education, each of those needs met is going to mean a greater outcome of long-term stability for the individual. This is an example of what a strength-based part of our tool looks like. Angela's going to walk you through the whole tool, but this is what a survivor sees after they take the assessment. As you can see, time 1 versus time 2, they're able to see their progress, moving from vulnerability into strength. The next level is better data, and this is the organizational level data and where we bring organizational level data together. For organizations and service providers, this data is low burden and integrated into their actual service delivery. One of the challenges with data collection for the social sector is that it often is a burden. The technology is really challenging to use. What they're being asked to collect doesn't feel relevant to the day-to-day work. And in some cases, we've heard that social workers, program staff are spending more than a day a week simply inputting data. This is not an effective use of time. We need our data collection to be low burden and integrated into service delivery. With Freedom Life Map, the platforms visualized in the technology equip organizations with essential metrics to guide and support intervention strategies and report on outcomes. So this is real-time data that organizations can use to understand where are they making the most impact and where are the gaps. Research shows that 78% of nonprofits with advanced analytic capabilities, so the ability to use data, reported higher effectiveness in performing their missions. We have to give organizations the power of data to unlock the impact and the potential that they have. This is an example of how we can show outcomes and exactly how Freedom Life Map shows outcomes over multiple times. So this is real data from the tool, global outcomes, 6 months apart at each time point, green being strength. So this is showing how survivors are moving from vulnerability into well-being. Lastly, stronger collaboration is key component of the Freedom Life Map platform. For the sector, so for the social sector and specifically those working to end exploitation and prevent exploitation, the Freedom Life Map data refinery turns data into insights. It aggregates data for policy and funding advocacy. It helps us scale effective programs through the outcome data, which helps us develop an evidence base. And it actually allows us to achieve collective impact and to measure collective impact. There's an incredible SSRI article out there about collective impact. If you haven't read it, it's a must read. But one of the key components of collective impact is having a shared measurement system. So we need to be tracking similar things so that we can show progress that we're making as a collective. Now, Angela is going to come up and share with us how the Freedom Life Map platform actually works, and she's going to share data with us from Orange County and globally so you can see how data at scale has real life impact.
All right, so I have the pleasure of showing the Freedom Life Map tool and how it works. And the whole concept of Freedom Life Map is around some concepts that don't sound that novel, but in the anti-trafficking sector, they largely are. So tools that are strengths-based and that really put the survivor in the driver's seat of their care. So having the survivor lead the assessment process, deciding what their priorities are, and the case plan following from there. So Freedom Life Map is accessed through Everfree's online tech platform, and there will be a trained facilitator present with a participant at all times to help them navigate the process and to be there for support. But it's the survivor or the participant who is driving the self-assessment. So they go through about 50 different indicators of well-being, rating their own situation, and then go through a process guided by that facilitator of identifying achievements, places that they've already had success in making progress, and how they did so, as well as identifying their priorities and where they would like to put their efforts to move forward. So this is what an indicator looks like in Freedom Life Map. This is one of the about 50 indicators. So this is measuring medical care. So you see a green, a yellow, and a red level. And the green level represents an existing strength or area of well-being for the participant, something that's already going well in the participant's life, where they already have some stability that can buffer against exploitation. The yellow indicates some level of risk, as well as some existing strength, and the red level indicates a higher level of vulnerability or need in that area. So the participant clicks through, identifies where they fall within each indicator based on reading the descriptions and seeing the visual depictions of what each level looks like. After they've gone through all of the indicators, they see a summary of all of their greens, yellows, and reds. And the facilitator at that point will guide them through a process of reflecting about how that feels to them, what they're experiencing as they look at this. What we often hear is that having the greens and yellows, the areas of existing strengths reflected back at them, is very rewarding for participants and very empowering to see that reflected for themselves and also to have their case manager recognizing the things that are already going well for them. The participant is then guided to select a number of priorities, which can depend on the kind of intensity or the length of the program that they're enrolled in. Generally, it might be 3 to 5 things that they want to focus on over the next 6 months. And they are then guided to answer a few open-ended questions. So in this example, the participant has selected savings as a priority, and they're asked to reflect on some of the barriers and challenges that they face related to that issue. Then they're asked what the next steps could look like for them. This might be something that they have ideas about, or their case manager or the facilitator who's working with them can also let them know about resources within the organization that they work for or external referrals that they might make to assist the participant. At the end of the priority setting section, this part is really important. The participant gets their life map. They are the owner of their data, so they can have this printed out or emailed to them. They can reference it at any time to look back on how they reflected on their life at this time, what the priorities are that they're working toward, and what their plan is to move forward. And that life map helps the individual understand their needs. It also helps the organization understand what their individual needs are and provide the individualized care that can help people move forward. Ultimately, this helps to stop cycles of exploitation by targeting the things that will most matter for the participant. And it can be used both with survivors of exploitation and those who are at risk. And I'm going to highlight a few key findings. So based on the global patterns that we've been seeing from use of Freedom Life Map across 7 different countries, highlighting some of the things that are most relevant here in Orange County and some broader patterns that we are able to look at when we have this kind of data on a large scale. So Freedom Life Map is organized into 6 different dimensions or different areas of well-being. So health and basic needs, rights and safety, housing, infrastructure and access, education, employment and finances, community and connection, and mental and emotional well-being. Globally, what we're finding are a lot of patterns of similarity across these 6 dimensions. So Kelsey spoke about the importance of having similar measurement systems across different places, and we're seeing that it's really effective to help us identify patterns in what's driving exploitation when we do have that similar way of measuring things across different areas. So what we're finding globally is that largely the area of greatest vulnerability and priority for survivors, as well as people who are at risk of exploitation, is in this dimension of education, employment, and finances. So here we have ranked in the 7 different countries where participants are using Freedom Life Map. The top row is areas where participants are identifying the most strengths. At the bottom is the most vulnerabilities in each context. So you can see education, employment, and finances is the #1 area of vulnerability across 6 of the 7 contexts, and it's the second most vulnerable in the last one. When we look at the specific indicators, so digging into beyond the dimension level, when we go into the 50 indicators and we rank which ones are presenting with the most vulnerabilities, as well as the ones that participants are prioritizing the most often, we see household income, savings, medical care, healthy teeth and eyesight, and money management are the things that are popping up in the top 5. You might notice 3 of these are in the kind of area of finances that has really popped out as an area of vulnerability. So it's a vulnerability, and participants are saying this is what I most need to work on to protect against further exploitation. When we hone in on those financial indicators, we see globally savings is the #1. 219 people have prioritized this globally. Household income is #2. Money management, so things like budgeting, understanding how to spend money effectively, accessing credit, investing, all of those types of things is the #5 priority globally. And then there's one more financial indicator, which is about managing debt. And not all participants have debt, but among those who do, this is also a very commonly prioritized indicator. So we were really interested in kind of digging into this in more detail and understanding what the specific barriers and challenges are that people face, as well as what survivors see as their pathway forward to make progress on these issues. So in this way, the data is helping us move from gaps in programming towards solutions. So this data is a thematic analysis from 60 participants in the Philippines who selected savings as their priority. So we looked at what people were listing as the barriers and challenges and kind of organized them into different themes that show what the major problems are that people face. So it's things like limited income. It can be things around people's circumstances, so maybe they're still in school or they're supporting a lot of family members. They might have debts or lack of money management knowledge and skills. We also looked at the open-ended data from those same participants about what they saw as their pathway forward. And the 3 different areas that popped out in that analysis were things around financial literacy, so understanding how to budget their money, how to spend, how to save, how to approach use of the money that they did have. And then we also saw a couple of things around generating more income, so things like entrepreneurship programs to help people generate new opportunities to make money, as well as employment programs to connect participants with existing jobs. And so in this way, the data is really helping Everfree's program in the Philippines to identify survivor-led programs and collaborations that can meet these needs that participants are expressing. So we see participants really do have the insight into what they need and how they want to get there, and programs now have the data that they can use to connect those dots. So later on, we're going to discuss the data from Orange County. We see a lot of similar patterns in terms of what people are prioritizing, as well as the pathways forward. And so we're going to talk a lot in the breakout sessions about some new pathways that are being organized around these financial indicators to help survivors in Orange County move toward greater financial well-being. So now I want to return to those 6 Freedom Life Map dimensions. because we know that with Freedom Life Map we can identify the gaps, but we also really try to focus on the strengths. And so I wanted to highlight as well that some of the greatest strengths that we're seeing, we also see global patterns that are very stark there. And one of the greatest areas of strength is identified as rights and safety. So returning to our 7 countries where Freedom Life Map is being used, we see rights and safety is in the top 2 dimensions across all of those 7 different contexts. And looking at data from time 1, time 2, and time 3, so how people progress over time, what we see is that participants are starting out strong in this area, so about 70% green responses representing existing strength or stability at time 1, but we do still see a lot of increases over time. So time 2, we've got over 80% green responses up to above 85% at time 3. Participants are invited in time 2 and time 3 to reflect on achievements that they've made, so places that they've made progress. They can record, again, in open-ended formats about what they did to make progress and what helped them get there. We see that among the top 6 achievements that people are logging at time 2 and time 3 are indicators such as freedom from sexual exploitation and rights and protections. So even though participants are starting out really strong in this area, they're getting even stronger with support from the programs that they're working with and through their own efforts to achieve greater well-being in this area. And what we see is that this largely reflects where the investments have been made in the anti-trafficking sector. So the United States spends about $248 million on average each year to counter human trafficking, and about 2/3 of this money is spent by the Department of Justice and the Department of State. So Department of Justice, of course, making a lot of investments in the areas of rights and safety, prosecutions, helping people understand their rights, and legal services. But only 19% of the funding that the U.S. is investing in anti-trafficking work targets reducing the risk of trafficking for individuals or even at a policy level. So all of those other areas receive kind of less funding and less attention. And so this kind of shows us what we can do when we have the data to show that further funding is needed to invest in certain places, such as finances and the financial needs that survivors are expressing when they're using the tool. And finally, I just wanted to end with one other illustration of how funding and services are linked and how data can help to better align funding priorities with survivors' needs. So we did some survey research with about 100 members of the public in California, looking at perceptions of the challenges posed to the United States by sex trafficking and labor trafficking. We asked participants how they perceive the severity of the problem of sex trafficking and labor trafficking in the United States. So the kind of gray bar is perceptions of sex trafficking, the black bar is perceptions of labor trafficking. We found that participants are concerned about both forms of trafficking and in fact equally concerned about both. But there's disproportionate funding and investment as well as access to services historically, where more is invested in the needs of survivors of sex trafficking versus survivors of labor trafficking. Even though the two are often co-occurring, and the prevalence of labor trafficking is actually thought to be higher than the prevalence of sex trafficking. So we were interested in kind of digging into why we see these disparities, even though the public is perceiving the two as equally problematic and severe. So we asked participants about the perceived harm of sex trafficking versus labor trafficking. And I'll just start by noting that people recognize that both are very harmful. The perceptions of harm for sex and labor trafficking are very high, but we do see statistically significant differences where people think that sex trafficking is more harmful than labor trafficking. When we give people a forced choice about which is more harmful, the results are quite stark. So nearly 60% of people think that sex trafficking is more harmful than labor trafficking. Almost everyone else thinks that they're equally harmful. Only one person thought that labor trafficking was more harmful. But when we utilize Freedom Life Map data, we find a different pattern of results. So we utilized Freedom Life Map data from Uganda, from Everfree's program in Uganda. And this is from survivors of sex trafficking on the top row, labor trafficking, or both forms of exploitation on the bottom row. And these are people who are basically straight out of exploitation, expressing what their well-being looks like coming right out of those experiences. And we're seeing similar levels of harm across all three areas. So regardless of whether people have experienced sex trafficking, labor trafficking, or both, we're seeing similar levels of harm across all of these. And so we think this really highlights how data could be used to advocate for the needs of survivors who might be overlooked in funding, in service provision, and in the prioritization that sometimes occurs when there are calls for funding and things like that. And so we see a lot of potential to use this data to advocate for those groups and show what the needs are. As we have more data, we hope to dig into more granular understanding of the needs of labor trafficking survivors and advocate for those groups. And so we're going to take a little break now from us talking, because we'd like to have some conversation at the tables and hear from all of you as well. And so, and I'll just mention as we go into the break, feel free to talk about what you wish, but there are a lot of people in the room who have done a lot of work here in Orange County and beyond on support for labor trafficking survivors, bringing funding specifically to support labor trafficking survivors to Orange County. And so we're also interested in hearing about anybody's experiences and how this type of data can be used in the work that you do or in the work that you're seeing in your community. So Kelsey will bring us back in about 10 minutes, but please, we look forward to hearing from all of you during the break.
Hello, everyone. Hope you all had very wonderful table conversations. We did. It's hard to break out of them. It was hard for me to get back up here. But the good news is, after this section, we're going to be going into breakout rooms to continue diving in to these deep, amazing conversations. So we want to conclude this section with talking about Freedom Life Map, which is now, I'm happy to share, a validated tool. Yes, very exciting. And some exciting aspects of the validation are the results of our random control trial. We did this over 3 time points in Everfree site of Uganda in collaboration with Innovations in Poverty Action, a human trafficking research initiative. This was led by Angela, and the results were so exciting to our team. So not only is the Freedom Life Map a valid measurement tool, the tool itself actually has outcomes. Just by using the tool, it is improving the well-being for participants. So in this trial, participants who used the Freedom Life Map tool as their case plan development tool were 1.6 times more likely to improve their well-being compared to those who didn't use the tool. So if you look on the Freedom Life Map care plan, you see those are the greens compared to those who didn't use the Freedom Life Map. The only difference in these two groups, there was no difference in service provision, no difference in anything they received, simply by having a tool that built their agency, that gave them choice, that gave them voice, that quickly got them connected with the individualized care that they need, created better outcomes over a very short time period. I think this is over about 12 months of service provision. This is really exciting. We're hoping to expand this into a larger scale RCT in the coming year. Through this study, we also looked at participant feedback to understand how are they experiencing the tool. What is their experience of it? Their satisfaction was above 85%. They rated also above 80% that it helped them to set priorities, so to understand their situation and then set priorities from there. And about the same level, above 85%, it helped them identify a pathway forward. It's very important to us to get this participant feedback because, yes, while data is important, it's not worth collecting data if we're hurting or exploiting people in the process. So we want to ensure that even in our data collection process, we're empowering, we're supporting, we're creating positive outcomes. We also looked at participants' emotions. So one of our questions, concerns when we got started was, is red going to be too discouraging for folks? Are they going to see that red and shut down? But we actually saw the opposite. Over almost every participant who's taken the assessment has around 50% greens at the first time point. So they're coming into a program seeing that they have quite a lot of strengths to work with as they work on rebuilding their areas of vulnerability. And the results really confirm that this red, yellow, and green is an effective model for helping survivors set priorities and doing so in a way that feels strength-based and hopeful. So over 80% of participants rated their emotions as hopeful, happy, and they also noted that they're proud of their progress. So one of the features we included in the tool, as you saw when Angela went through it, is the ability to mark achievements. And it's been so fun for us to see this and to be able to report back to funders, to organizations, to see those achievements. This issue can feel really dark. It can feel really overwhelming. But with Freedom Life Map, we get to inspire people that change is possible. Transformation, hope is possible, and we're seeing that in the participants. Less than 20%, around, looks like 17%, had some feelings of sadness, and a little over 20% felt some anxiety. What we're working towards with Freedom Life Map is a really big vision. We are hoping to scale more effective and more efficient solutions to stop exploitation and ensure freedom for all. And Lindsay and I were just talking about pathology of being hopeful. I believe with all of my heart that this is possible, and that coming together around shared data, coming together with a strength-based approach, we can make tremendous, tremendous progress. And a part of that progress is ensuring that those who've experienced exploitation and those vulnerable receive the unique, effective care that they need. So not just access to justice, but access to programs to help them build up a savings, access to programs to have decent work that meets their needs. The next area of impact we're working towards is for communities and organizations to understand and then deliver the most effective solutions. We have incredible service providers in Orange County and beyond who work tirelessly day in and day out. And our role at Everfree is to equip these organizations with this data ecosystem to help them have the insights, to make improvements to their program, to have real-time data to meet those needs, show their outcomes to funders, raise more money, and serve more individuals. And lastly, we're working to equip the global movement, to unite the movement with data-driven collaboration so that we can scale what actually works, so that we can drive policy and influence resource allocation. Right now, globally, less than 1% of survivors ever access care. With this model, we can completely transform that, and we can go upstream to prevent exploitation before it happens. Our vision for Freedom Life Map is to scale this tool here in Orange County and globally. And it's quite an easy tool to scale because it's deployed through a network of partners. Everfree, our organization, does direct services in Uganda and the Philippines, and we're not planning to grow those into any other countries. We know that incredible organizations exist all around the world, and our role is to equip them with the Freedom Life Map and then bring folks together like we're doing today around data so that we can make meaningful progress. This model is also working towards sustainability. So we will be introducing a pay-for-service model that will help us become less and less reliant on private philanthropy over time. In the next 2 years, we are working to have 10,000 life maps completed, and we are already on track to achieve our goals for this year, hopefully extend them. We are hoping to onboard 100 global partners with over 1,000 users. Users are program staff. And we're working on our global sustainability. This isn't possible without an incredible network of partners. First, as you heard Dean Gould share, Everfree and UC Irvine work hand in hand, almost like the same exact organization, towards achieving these goals. If you think of that data pyramid, UCI is really helping with those top 2 levels, aggregating data into actionable insights, and doing so in a way that's really meaningful and understandable to organizations, policymakers, and funders. We've launched Freedom Life Map in Orange County. Many of these organizations are in the room doing incredible, incredible things, and we're hoping to reach even more organizations. We have hubs as well in Southeast Asia, and we're launching Latin America and additional hubs in the US next year. There's a lot of exciting things that are going to be discussed in the breakout rooms. We have a breakout room that's going to be focusing on taking Orange County data and turning those insights into action plans with different service providers. So we have direct service providers here who work with vulnerable children, who work with survivors of exploitation, and then we have organizations who do incredible work with trafficking prevention, with financial literacy, with access to jobs that actually meet their financial needs. One we're excited to speak about is a partnership that we formed with the Global Center for Women in Justice. They're also Samueli Foundation grantees, and as a result of that collaborative model, they are going to be using Freedom Life Map for prevention with school-aged children in Orange County. So not only is Freedom Life Map being used with direct service providers, it's also going into our schools so that we have more data that's actionable. There's so many exciting partnerships that we're going to be exploring in the breakout sections. So I want to help you understand where you are going.